Environmental toxins such as air pollution, heavy metals, pesticides, and chemicals in food and water can silently affect cardiovascular health over time. These toxins can trigger inflammation, damage blood vessels, raise blood pressure, and increase the risk of heart disease, even in young and otherwise healthy individuals. Addressing us on this topic is Dr. Praveen Saxena. Dr. Saxena is a physician and integrative medicine expert with over 30 years of experience in treating chronic illnesses through science-based natural therapies. Trained as a radiologist, he now focuses on environmental and functional medicine, including detox therapies and holistic approaches to cellular health. Dr. Saxena, please.
Thanks a lot at the outset. Such a ambience. I'm a slightly a musical guy. I'll start with a simple this one. Again, a Hindi song. हर घड़ी बदल रही है रूप जिंदगी साइंस भी बदल रही है छाव है कहीं कहीं है धूप जिंदगी what an atmosphere what we have I doubt in Hyderabad we don't have this kind of things at all coming to this Anand Agarwal my great friend somewhere I'm really happy that I came to this, started with the yoga in the morning after a long time. And I'll just try to do a few things. I'm not, there is no financial interest. I'm not come here to sell anything. I'll be focusing on what is the trend now. Why that yesterday, that question somebody raised, why young hearts, why there is sudden heart attacks which is happening all over. Let us try to look into some of the things. So we all talk about elephant in the room, but we don't want to acknowledge that. I worked on something called metal toxicology, and I started working on autism. After that, I started looking into metal toxicology, and we felt this is a public health issue. Most of the vascular toxic metals are in and around you. We know about Delhi air pollution. This place is absolutely ambient, no pollution here. But the people who are living in the metros as well as the 2 and 3 tier cities, they are facing this ambient air pollution. Air pollution, when we talk about for the students, I'll tell you what exactly is this air pollution. You have got 2.5 and you have got PM10. If with 2.5, it's ultra thin particulate matter, whatever goes into your lung is gone from lung. There is a membrane. From there, they get into the vasculature. So all the particulate matter of 2.5 PM, which has got lead, mercury, whatever sorts of thing, what you can say, it directly gets into the vascular system. We have been trying to scratch our heads. What is the initiation of this? Atherosclerosis. After all, we believe cholesterol is an innocent culprit. When you scratch this surface, you have got this pathway, you have got a lining, and if there is a scratch over that, then cholesterol comes over that and tries to make escape. So we'll just go across some of the things. We need to, there are some students, you can always look into what this guy is talking. There is a thing called transitional metals, heavy metals. And everything is related to role of calcium, magnesium, good minerals and bad minerals. Again, it is also a Mahabharata happening with this particular thing because all the water what we get in the cities are having a high levels of mercury, lead, and all that. Arsenic is so predominant. So we'll just look into this particular thing. There is we had done few cases which has got coronary calcifications, and with this coronary calcification, we are able to estimate as a radiologist. I used to tell, okay, you are in a more chances to get a heart attack. And what exactly is this? Because this is a recent phenomenon. Probably we don't had that, but we started doing CT angiographies way back because with the Suresh we did with 64 slides also that one, but that were not that this one. Now that the fourth generation thing has come, we can pick up quite easily. But after something last 4 or 5 years, where everyone is coming up with some calcification score, and he's asking what can be done for that. Let us see. We had identified heavy metal in the urine of the patients who are having toxicity. And Dr. Sharma, India is a very toxic place where water, air, you cannot have any bharosa about water, what you are having it. So this is what exactly is coronary calcification. You see the calcification in LED. Your doctor Deepak will tell, no, we'll go for an angiography. Fine. Why exactly this atherosclerotic plaque, and what exactly is it? It is an activated NF kappa B calcification, and you see the kind of things, how it activation of this transcription factor and how it goes up. And you have so many, don't want to confuse you with all that particular thing, but this is the rationale why things are happening. So there is a stains, people have done some work on that. Finally, it was found that it was a macrophage activation. Monocytes come into picture. You have got osteoblast cell-like cells, and there forms a calcification. So now that the patient comes with this calcification of, say, 400 score in the LAD, and now what to be done? So what we started looking at, Dr. Saab, is we picked up blood lead levels of these patients. Once we picked up the blood lead levels, what we have seen, there is no uniformity in the lead level status of people. In US, 0 to 5 is considered normal. Here, up to 150, ThyroCare gives up to 150 is normal. I don't think we can really survive with that. We cannot follow 50 years old standards. So